Osteoporosis. Describe them to me. Postmenopausal, small-framed, Caucasian or Asian women, because you got some white Mexicans too. You got, so it's Caucasian or Asian descent. That's right. When I talk about osteoporosis, guys, what's happening to the bones or what's not happening? Reduction of bone mass. Okay? Think of the word osteoporosis. It's porous. It's got holes in it. So that's what's going to happen. Let's see. Do we know what a bone spur is? Like a what? Just think of it as an inconsistency in the bone mass. Think of it like that. Okay. If I ask you guys to recommend a diagnostic imaging test for my brain, for the tissue of my brain, MRI. Okay. If it's going to be to look at a
CT.
Okay. Now, for those of you that are, I'm assuming you guys are, Ms. Beignet, do you have a question? No, go ahead, because I think I know what.
I thought the CT was.
Yeah, that's what I was going to get at right now. So, it's true. The CT scan is usually done for the head and the cervical neck, right? I talked about that. But if I talk about your brain, tissue is more MRI. Okay, soft tissue is MRI. And if you guys remember, the brain is soft tissue. If we're talking about bones or hardening structures, that's a CT scan. Now, but if I specify with the brain, it's going to be that. Okay, because the brain is the soft tissue. If I want to talk about a head injury, I want to talk about my cranium. What are you gonna give? A CT scan. Okay. If I'm talking about an MRI, magnetic resonance imaging, what type of patient teaching are you gonna give? Remove everything that's all jewelry, have nothing that's metal. Warn the patient about potential claustrophobia. Okay, because there's a tight, it's a very confined space. All right, let's see. Anytime you're going to have a patient undergo a surgical procedure, anything, let's say knee arthroplasty, are you going to give them any aspirin? No, nothing that may aggravate bleeding. Okay, I know I make up words sometimes. Sorry. If I have fibromyalgia, what's happening to me? Everything aches, and I don't know what it is. I get depressed. They give me antidepressants. If I tell you that I have the Heberden nodes, what disease do I have? Osteoarthritis. Osteoarthritis. Okay? Now there's osteomyelitis, osteoarthritis, osteoporosis. Osteo is bone. Arthritis, that A-R-T-H-R, that's joint, right? That myelitis, it's that infection inside the bone. And osteoporosis, the bone is, the holes. Think of it like the holes in the bone. It's not really holes, guys.
But it's reduction.
Exactly, the reduction of the bone formation. Okay, good, because of lack of calcium. All right. If I tell you that I have swelling in all my bony prominences, and I'm always fatigued, what do I have? Rheumatoid arthritis. Okay. If I'm taking allopurinol, what disease do I have? Gout. What does allopurinol do? It decreases the production of your uric acid. Okay. If I had a fracture, let's say, and I'm immobilized in the bed because I fell off, I parachuted, my chute didn't open because my wife was pissed at me, but I fell. You guys heard this happened actually. This guy, he fell face down. She fell, but her body weight was distributed evenly, so she didn't die, but she broke virtually every bone in her body. So now, let's say she's in bed, she's immobilized, what complications is she going to have? Okay, yeah, back sores is good, yeah. Back sores, what else? Embolisms due to venous stasis. You're also going to have muscular atrophy. You're going to have, what else? Contractions, that's right. Is your skin going to break down?
Yeah.
That's right. Are you going to have constipation or diarrhea?
Constipation.
Why not diarrhea? Yeah, because you're not moving. Think about this, guys. All this, we just ate, right? So it's working its way through. So we're sitting down right now. The Subway that I ate, it was a delicious Subway, by the way. It's still in my stomach. Eventually, it makes its way down my intestinal tract. Damn, that's me. Thought it was you guys. I was like, all right. So once it makes its way down its intestinal tract, if I don't move around, guys, it decreases peristalsis. I'm going to become constipated, not having diarrhea. All right, good. When I talk about risk factors for osteoporosis, are young or older people going to be having osteoporosis? Men or women?
Women.
Women. For osteoporosis, yeah. The only one that's men, guys, is which one? Ankylosing spondylitis. Yeah, that one that we can't pronounce. I can't pronounce it sometimes. All right. Good. If someone's going to have an x-ray, remember I told you guys about my son that had an x-ray on his ankle when he twisted his ankle, he sprained it. And what did I tell you guys that I told my son about the table? It's cold and it's hard. You guys remember me saying that? Maybe I told my other class. I think I told you guys too. But that's one of the most basic things you can tell the patient. My son was really uncomfortable because the table, it's really hard, maybe like this. Okay, and it's usually really cold, and you have to expose the actual leg when you're actually going to do, or whatever part of the body needs to do, have an x-ray. So you're going to let them know that the table is going to be hard, it's going to be cold, and you might be uncomfortable. Because the doctor kept telling my son to rotate the foot that way and then to internalize it as well. So is he going to be comfortable?
Yeah.
No, it's going to be really awkward, uncomfortable positions. All right. Let's see. When it comes to giving medications, guys, especially pain medications, always consider the parameters. If the medication is ordered every 3 hours, and the patient wants it an hour and a half, you can't give it. You can order for breakthrough medication and stuff like that, but you can't give the medication before its due time. Does that make sense? All right, good. If I say unicompartmental arthroplasty, what does that mean? Part of that one knee. Okay, it's unicompartmental. Remember that the book talks about 3 compartments: the side compartments and the middle compartment. So unicompartmental means I'm working up on that specific compartment of the knee. Okay, that's what it means. So please know what unicompartmental is. What does it mean when referring to the joint, the knee joint? If I have a hip fracture, am I going to keep my leg abducted or adducted? Abducted, like that. What can I put in between? Pillow, okay. What medication suppresses the TNF, the tumor necrosing factor? Embro, but what, I told you guys to know it as the other name as well. Yeah, etanercept, okay? ETANERCEPT. It's also known as Embrel, okay, but know it as etanercept. The TNF. Remember the tumor necrosing factor, guys? Tumor is tissue or growth of tissue, right? A necrosing is wasting away, dying, and factor is just a factor that we use, a word that we use to mark certain chemicals. So when we have an inflammation, in particular rheumatoid arthritis, TNF is present here. It's destroying the tissue and it's becoming really inflamed. So this medication blocks that aspect of rheumatoid arthritis. If I have gout, what lab tests are you going to do specifically? Think about what gouty arthritis is. Yeah, you want to assess the uric acid, the uric acid serum level.
That's what it's called?
The uric acid serum level? Yeah. Uric acid level. Serum I said because it's fluid, it's blood, plasma. All right. What are the normal calcium levels? Oh, give or take. Some. I can't even talk. Some literature guys might lowball it a little bit. Might say 8.7, 8.8 to 10 something, right? Don't get discouraged by that. Understand this: if it's too low or too high, that's what you're gonna. If the calcium level is too high, what disease do you have? We just went over this. You have cancer because remember the cancer, the cells of the osteocytes, they're not working, they're not functioning properly. So it can't absorb the calcium. Therefore, your bones have no calcium in it, but it's not because there's a lack of it. It's just it has an inability to absorb it. When you have osteoporosis, though, what's happening to your calcium levels? It's low. Because remember, postmenopausal, we talked about the ability of the body to actually gather that calcium. If we're not regenerating it from our diet, then our body can't really get any once you're postmenopausal. So what are we going to do to make sure that they get that calcium? Give them calcium supplements, yes. So for osteoporosis, low calcium. For bone cancer, high calcium levels. And I'm talking about significantly low, okay, folks? I just said the average value I might lowball it. It might be lowball depending on what literature you look at. It could be 8.8, 8.7 to 10 point something. That's still okay. I'm talking about 6.0, 7.0. That's significantly lower. Okay? Let's see. What's the whole purpose of the CPM machine?
Passive range of motion.
Yes. What's its purpose though? What's the purpose of range of motion, guys?
To prevent contraction.
Yeah, to prevent contractures, to maintain the mobility of the actual extremity. If a patient's in prolonged bed rest, what are they susceptible to when it comes to the bones?
Atrophy.
Okay, atrophy is a good start. Wasting away. What happens when your bones start wasting away? What are they susceptible to? Fractures. Pathological fractures, okay? When it comes to osteoarthritis, what type of exercises do we want to give the patient? First of all, what is osteoarthritis? What is it?
It's in the joint.
It's DJD, degenerative joint disease. Okay, it's not autoimmune. Autoimmune would be rheumatoid arthritis. Okay, so we figured that out. When you have osteoarthritis, what type of exercises do you want to give this patient?
Sitting and walking.
What was that?
Walking and sitting.
Oh yeah, exactly. Low impact. Okay, low impact. So yeah, bicycling is good, jogging is good, swimming is good, playing Wii is good. Okay, all that stuff is good. You guys like how I did that? All right. Remember I talked about being able to describe how you assess certain pain types? So if I asked you guys about how do you ask a patient if a pain is radiating, what do you ask them? Does it travel anywhere? Severity on a scale of 1 to 10. And the description would be describe your pain to me. How does it feel? Okay. What happens if the patient has, if I have, let's say, I have osteoarthritis, and let's say I take NSAIDs. What happens after prolonged use of NSAIDs? What might happen to my stomach? Okay. Bleeding. Yeah, GI bleeding. Not so much constipation, but bleeding. NSAIDs. Or anytime you have a prolonged NSAID therapy, you run the risk of irritating your stomach. You might develop some type of internal ulcers. Remember, I'm sorry, I didn't go. I'm all the way up here. Let's see. Am I gonna have an elevated ESR during osteoarthritis?
No.
No, I'm not good. Well, what is it?
An emergency signal?
Yeah.
Flash flood?
Yeah.
Amber alert? Oh, a bunch of you guys. Yeah, right there, right there. All right. So yeah, so ESR is not elevated for osteoarthritis because it's a non-inflammatory disease, right? Which will the ESR be elevated for? Rheumatoid arthritis, or RA. Okay. Let's see. Yes, go on. I'm sorry, I don't know what you're saying. Say it again. Uh-huh. Yeah, it's going to be ESR as well because of the inflammation. But is that going to be specific for your gout? No, because remember, ESR is just a non-specific. Go to page. ESR is a non-specific.
Yeah, it's a number.
You guys have that app on?
It's not an app.
It's
already installed. Whether you want it or not.
Okay, it's okay, I saw this. Alright, so where was I at? Okay, so again, for osteoarthritis, guys, non-inflammatory disease, so your ESR will not be elevated. Rheumatoid arthritis, it's an inflammatory, so it will be elevated. For gout, it'll also be elevated, but how do we know if it's gout? What are we going to do specifically? Uric acid. So remember, guys, the ESR is a non-specific blood test that we can assess to see if there's a generalized inflammation anywhere, but it's not very specific. It's non-specific. That means that your body's fighting something off. Okay, that's all it means. Make sense? All right. Guys, remember that muscle allows you to maintain posture. It allows you to move. And it also does what? Production of heat. Production of heat. It also does what to the veins? It promotes venous return. Okay. Not hemopoiesis, that's production. When we talk about our heart pumping blood to our body, the heart pumps and the blood vessels contract, right? Remember, if I sever an artery, it's going to bleed out a lot. But if you sever a vein, it's not going to bleed out too much because it's not highly pressurized. So what makes that blood go through our body? Remember, we talked about this back in term 1 in A&P. First of all, remember we talked about the chambers inside the blood vessels that it can't go back in, and also muscle contraction. As you guys move along, your muscles squeeze, they contract so they actually squeeze the blood through the veins. That's another property of your muscle. That's something else that they do. A lot of questions on osteoarthritis versus rheumatoid arthritis. Okay, guys, make sure you know the difference. If we have a bone biopsy, what's going to be the biggest risk we're looking after? Infection and bleeding. Okay, infection and bleeding. But when we do a bone aspiration, guys, we're going inside the marrow, so it's highly vascularized in there. So are we going to have the patient move around a lot right afterwards?
No.
We're going to put high pressure, not to cut off the blood flow, but direct pressure for quite some time. Okay, and you're also going to immobilize the patient for several hours. All right. What's a risk factor for developing osteoporosis? What's a modifiable risk factor? How about that?
Lack of calcium.
Okay, so that's right. Not consuming it in your diet. Good, good, good. What's oh wait, did I say non-modifiable? Modifiable. What's a non-modifiable risk factor for osteoporosis? Non-modifiable means I can't do anything about it. Genetics. So specifically, if I'm a 45-year-old Caucasian woman, right? A small frame, also and/or Asian. Okay, all right. I can't do much about that. Which type of diagnostic test am I gonna give someone so we can assess their spinal column, to visualize their spinal column?
Are you gonna ask?
No. Myelogram, good. I think it's the first diagnostic test we talked about. Myelogram, guys. Myelogram. It's to assess the spinal column. How about to retrieve fluid from the knee to see if there's an inflammation? Yeah. Synovial aspiration. All right. How about what type of precautions are you going to take, or patient teachings, when you're going to do a myelogram on a patient? What are you going to tell them? What do we have to look after? Allergies, because there's a dye going inside the patient's spinal column. All right, good. What do we want to encourage for patients with rheumatoid arthritis? Sleep, rest. Remember, 8 hours of sleep, even a nap during the day.
2 hours.
What was that?
2 hours.
2-hour nap? That's a long nap.
It's in the book.
Oh, then never mind, but it's still long. That's a long nap. Okay. If I tell you guys I have gout, and I tell you I want to eat rice, is that okay?
Yeah.
If I tell you I want to eat, chicken liver, is that okay?
No.
Oh, okay, good. How about apples?
Yes.
How about lemons?
Yes.
Ah, tricked you guys. Yeah, it's just got acid, but not uric acid. So lemons are fine. Sorry, I know. So yeah, lemons are fine, guys. Oranges are fine. Uric acid can purines. Remember all the other foods that I talked about. All right. What's essential to do before you start gold salt therapy? Test dose. Okay, good. Let me see. What do you want to make? Are we going to elevate or keep the leg lowered when we do knee arthroplasty? Elevated. And what's going to be the limitations of the angle that we can flex? 30 degrees. No greater than 30. No more than 30. 30. 20. 20 to 30 is fine, yeah. But guys, if you guys ever see a question and it says like, don't look for like, oh, it's got to be between 20 and 30, but it doesn't say between 20. No. Just critically think, guys. Okay, that's why I gave you that range, 20 to 30. What's so cool about having knee arthroplasty regarding, not so cool, I'm sorry. Yeah, that's very subjective. If I have knee arthroplasty, how quick can I resume my activities? 3 to 4 hours. Now, am I going to start running right away? No. Any type of surgical procedure, we gradually increase depending on tolerance, right? Me, I'm a sissy, so I'll say like, oh no, I can't, it hurts. Okay. However, my friend Edgar, he'd be like, oh, I'm ready. Also because he weighs a lot less than I do, okay? What happens if I just had knee arthroplasty, and describe to me some normal signs and symptoms post-surgery, post-op, of knee arthroplasty? Pain. Okay, but it's relative. How much pain? Mind you, I had pain before I went to surgery. So they did my knee arthroplasty, they fixed it. How much pain am I supposed to have?
Severe.
Huh?
Severe?
No, you're not supposed to have severe pain. No. No, you're supposed to have very mild post-op pain. That's it. I'm talking about 2 to 4, no more than 4. If you're talking about severe pain post-op, there's something going on. If you have automatic swelling and automatic pain right after surgery, there's something going on. You have to report it to the physician. Okay? So pain is not normal, especially for something very minor like knee arthroplasty. If you had open heart surgery, yeah, you might have incisional pain and things like that, but on the inside, it's not supposed to be hurting. All right? When we talk about patients with arthritis, what do I mean by we're going to take a multidisciplinary approach? What does that mean? Okay, physical therapy. What else? What does multidisciplinary mean? What was that? Yeah, you're going to try from several different disciplines. So we're going to have the occupational therapist, the physical therapist. We're going to have I was going to say speech pathologist, but we'll have the speech pathologist, we'll have the nurse, we'll have the doctor. Several different disciplines are going to be at work to make sure that this patient recuperates. That's what I mean by multidisciplinary. Now, what are the advantages of having multidisciplinary care? Yeah, we attack it from different angles. You guys ever seen the show Breaking Bad? You guys remember when Hank got shot up and he was doing the physical therapy?
Yes.
Then they were the specialized health care. Remember he got like a special therapist to come in. Essentially, what they were trying to show is that we're using a multidisciplinary approach. We're affecting it from all different angles so it can maximize the patient's recovery. All we're doing is physical activity, and we don't do occupational activities such as putting your shoes on, putting your socks on, then it's going to be very limited. If we do multidisciplinary approach, it'll be better. Now, when it comes to the diet for gout, guys, I talked about seafood, right? But specifically, it's going to be sardines and anchovies, okay, guys? Also, the, what's that other fish? Scallop is another one, but it's got an R in it. I forget now what it's called. Harold or something? No, not mackerel. Mackerel is one of them too, but the herring. Is it herring? Okay, so those are all seafoods, but don't be confused. If I tell you the patient's going to eat, if the patient's going to have salmon, that's okay. Okay, if the patient's going to have salmon, that's okay. If the patient's going to have tuna, that's okay. Bass, that's okay. I'm talking about specifically your anchovies, the herring, mackerel, scallops, and also the sardines that I talked about. Okay? Make sense? I put down sardines as well. You guys put it last time?
I did.
Okay, so remember those. Why would a postmenopausal woman lose 2 inches in height? Osteoporosis, I like that. Osteoporosis. Okay, eventually they get a little shorter. Okay. If I talked about the most common complications of either a knee arthroplasty or bone aspiration, right? We talked about it being infection and bleeding. Which one happens first? Bleeding happens first. Bleeding happens immediately afterwards. Infection, it takes, the organism has to go in. Remember when we talked about the infection cycle? Incubation period, all that good stuff. So all that has to happen before we see the manifestations of the infection. So bleeding happens first. Am I going to take digoxin or Motrin for rheumatoid arthritis? Motrin. Why would I not take digoxin? It's for the heart, right? Okay, good. But yeah, you shouldn't. Okay, good. Main clinical manifestation for ankylosing spondylitis.
The bones fuse together.
Okay. Wow, what's that going to manifest into? Lower back pain. Yeah, who gets affected? Who was affected by that? Young dudes. That's right. What kind of foods are high in calcium? Broccoli. What else? Milk. Yeah, yogurt. Okay, yogurt would be good. Yeah, that's good. Now, as we get older, guys, we have, I talked about osteoarthritis. What happens to the joints? Physically, what happens to the joints? They wear down, right? So they smooth or they rough? Rough. So once it gets rough, it gets really inflamed, right? Good. So that's good. You guys have any questions? No? All right. Before you guys leave, I'm gonna let you guys out early. What time is it? It's 2:35.
Yeah.
Oh no, I changed it back. All right, guys, study please. Do really well on tomorrow's exam. All right, go home. You're welcome, Ray. Sleep a lot, so you guys can be alert tomorrow.
What happened?
Sleep.
Why?